lots of things going on. Hi, everybody. My name is Andra Davis. I'm at University of Portland, and my partner in crime here today, Dr. Glover.
Toni. Hi, everyone.
It would be great if you all would put in the chat where you're participating from, and maybe if you have experience with the ELNEC graduate curriculum while we get things started. You all disappeared from my screen, so I can't see faces, unfortunately. Can you see my screen?
Yes.
Thank you for a voice. I can't see you at all. I wonder if I can go over here and, oh, there you are. Now I found you. Okay. All right, so we're going to get started. This is part of a series that we have started in January, where we're kind of going through each one of the modules, the ELNEC modules, and alternating between undergrad and graduate. So today, Dr. Glover Toni is has graciously decided, or offered, I should say, to share with us her experiences at Oakland University, and maybe before there, around into strategies, teaching strategies in using the ELNEC graduate curriculum. So how many of you are new to these series?
I'm seeing in the chat box some comments from folks that say that a few people have experience with the graduate program, but probably almost an equal number have not used the graduate program as of yet. And then someone just raised their hand. So I think it was Marie, if you want to chat, go ahead and just unmute yourself.
No, I was just answering the question.
Okay.
So if you're new to these, so we have, yeah, I see the chat now. We run these really informally, a little bit of presentation stuff, and then really the richness is a chance for us to talk to each other and hear from each other about what you're doing and sharing those things for folks that have not been using the curriculum. So we're going to do a little drive-by of history and kind of why this matters and how it fits within the context of nursing education. I think maybe someone's not muted. Maybe, there we go. Thank you. So historically, this is, some of you may be familiar with the call to action that came from ANA and the HPNA organizations for nurses to lead and transform palliative care. So that's, many of us have been sort of on this, had this as a passion for many years, but it was recognized as an important thing for nurses to lead in 2017. And their number one recommendation out of that document was to adopt the end-of-life nursing education consortium curriculum that there are many different curriculum that have come out of ELNEC over the years, starting 22-ish years ago, I think. And at the time of this document, the online undergraduate curriculum had been released, but the graduate curriculum was not yet available at that time. But now it is. And so 2019, it was released. So we're here to kind of share that with you. And so there's now also this intersection with the essentials. Some of you may be really intimately familiar with ACHPN's essentials that came out in 2021 that really have divided up core competencies for level 1, entry to practice, and level 2, advanced level or graduate level students. And so when that happened, they, for the first time, sort of centered hospice and palliative care as one of the 4 spheres of care that all students should receive education around, basically. If you are unfamiliar with the essentials, happy to share those with you, but you can just Google ACHPN Essentials and they will pop right up. So there were competency statements developed for graduate education prior to the release of the essentials. And when the essentials came out, a team of us wanted to look at whether or not how those essentials lined up and crosswalked with the essentials, the domains and competencies and subcompetencies of the essentials. And the GCARES of 2019 had been kind of divided into direct care and general graduate master's DNP level. So there were 8 that were directed and focused on the DNP and graduates, and then 5 that were really around people that were going to be in direct clinical care. So as the essentials were not divided into type of practice for graduate education, we took those original GCARES and put them together in a way that aligned as a set of competencies for graduate students across different scope of preparation, and ended up with 12 competency statements. Now, I think in a couple of minutes, I'll put those in the chat, or maybe Toni, you can pop those in the chat for folks that might want to take a look at those, download those, see how they may be useful as you kind of assess where you're at with incorporating those competencies into education.
Yeah, they're in the chat at the very top of the chat. There's a document that you can click on and open.
I think, though, Toni, if I put it in there before everybody got here, they might not be able to see it.
Okay, I'll add them again.
So I thought I would take a look at the GCARES, the newer GCARES, the revised GCARES, and the 12, and like see what would be sort of communication focused, sort of directly, and then maybe communication adjacent competency statements, because we're going to be looking at the ELNEC graduate online module for communication. So the one that seems to directly align is utilize advanced palliative care communication skills with patients, families, and team members as appropriate to one's functional area of nursing practice and professional context. So that's sort of how we've given a global statement for whether or not leadership today.
Andra was sharing, and okay, can everyone see that?
I can, and Toni, I can watch the chat box until she gets back while you're doing this too. Okay.
Okay, thank you.
You bet.
So let's get to where she was. She was talking about the competency statements. So if you look in that document that we previously shared in the chat, there are the competency statements right in that document, and they're written in a competency-based language. So for most of us who are faculty at universities, we're all working on changing the language of our course objectives and our program objectives to competency-based objectives. And so these are a wonderful guide for what you could incorporate into your curriculum as you add the ELNEC graduate program or the undergraduate program, to your curriculum. And then, the recommendation as part of the AACN Essentials has been to incorporate palliative care into curriculum, because it's one of the 4 spheres of care, and especially for our advanced practice nurses who are going to be responsible for leading conversations on serious illness care. So that's just one of the recommendations. And then this gives a little bit of the ELNEC history. You can see that it started with core and geriatric, then pediatric, and then it became available online, undergraduate, and new graduate, and then in 2017, and that's when these programs were available online, and then the graduate program, it became available in 2019. So I think there's something like close to 400 schools that are using the graduate program, but a lot more, like in the thousands now, who have incorporated the undergraduate curriculum. All right. And so the modules that are in the graduate curriculum, and just as a reminder, you can get a copy of the ELNEC graduate or undergraduate curriculum from Relias as a faculty member for free to review. So you can write directly to Relias, or you can contact Andrea, and she can help you with that as well. But there are usually there is a module that's module 1, and is introduction to palliative care and the leadership in primary palliative care for the advanced practice nurse. Then module 2, which we're going into a little bit more detail today, is the communication, serious illness, and then pain assessment, symptoms assessment, and then loss, grief, and bereavement, and final hours or care at the end of life. Oh, so here are the numbers of schools. So over 1,100 undergraduate schools are using the undergraduate ELNEC program, and 372 schools are using the ELNEC graduate program. So, all right. So before we go here, because I don't have the links to what videos.
I'm back.
Okay. Sorry, Andra.
I wonder if should I try and share the
yeah, let me not.
We're going to take a little drive through.
Let me
Okay.
let me not share.
I just recently started having trouble with my Wi-Fi, so I apologize, everyone. We're going to just take a look so that and we can talk logistics about how you can access these modules, and then we're going to share a little bit about what different schools are doing. I'm not going to turn my video on, and let's just take a look here. And somebody let me know if I'm starting to wax and wane again.
Yeah, I can.
Okay, so here is great. Thank you. Learning objectives. And I want to sort of just show you the intent of this drive-by of the curriculum is not to really dive into the content so much, but just to show you how students engage with material. So the setting the stage here, looking at through a couple of these slides so we can show you a little bit of the interactive being, and students cannot advance without completing the instructions on the different slides. So as you can see right here, there are other important culturally sensitive questions to include. So it gives folks an example of conversation about pronouns, how they would like to be addressed, and what language do you prefer to speak. And
Andra is switching over from to a dial-in. I can share a little bit about my experience with using the ELNEC program at Oakland University. So I'll just start that and hope that it's okay. So we can keep. We want to definitely hear from all of you as well about your experience with using ELNEC. So at Oakland University, faculty teach across the curriculum. So when I joined the faculty in 2018, I immediately got an internal grant for $10,000, and I just used the entire grant to incorporate the ELNEC undergraduate curriculum into all 3 of our undergraduate tracks. So RN to BSN, which I was teaching in, the traditional, and the accelerated second degree. And interestingly, in those programs, it was in a different class in each track. So as you're considering, what schools or what course you want to incorporate it into, or if you want to incorporate it across the curriculum, what courses you would like to insert it into. It doesn't all have to be the same course. It can be different based on the needs of that program track or those students. And then this year, I'm a geriatric nurse practitioner as well. So I was asked to teach advanced concepts in gerontology course, which in our program are adult gero, acute and primary nurse practitioner students take. So like one of the issues is that the family nurse practitioner students are not getting this content currently, and that's something that we still have to work on. And of course, palliative care spans the lifespan. So you might wonder, well, why is it in a gero course? A lot of times you need a faculty advocate or a faculty cheerleader to insert this content. And since I was teaching the course, and it's one of the general courses that both acute and primary adult gero nurse practitioners take, it seemed like a good place to place this content. And I did that for the first time this semester, which is just finishing up. So I have some feedback from students to share with you. And I mean, I have heard of people in schools where they have one module and one course, and they have another module and another course. And for me, that has just not worked out because it is hard to sustain or make sure that it stays in that course. One of the things that we're working on as we switch over to competency-based education is actually to put the ELNEC, both the undergraduate and the graduate, into the essential content of the course, so that regardless of who teaches the course, the content will remain there. And I think for the nurse practitioner, for the students who are in nurse practitioner programs, the important part of these modules that's different from the undergraduate program is they're actually going to be the ones who could be leading serious illness conversations. I remember at one point I was in a training with Connie Dallin and Patrick Coyne, and it was an APRN training when I was still in school. And, it kind of hit me like, wow, first time of really thinking that I could be sharing bad news, scary health news with a patient or family for the first time. And what would that be like? So the module does a beautiful job of just basic communication rules of building a therapeutic alliance and reflective listening and taking into cultural considerations. But then it goes beyond that in terms of some of the communication techniques that nurse practitioners can use to engage with patients and families on serious illness. So like the ask, tell, ask method, or giving a headline before, giving bad news, pausing, using silence. So the module goes a little bit beyond what the undergraduate module is. And Andra, feel free to chime in or, add any information whenever you wish. So
I'm quiet because I'm afraid it's going to happen again. So I'll just chat.
Okay, I'll watch the chat too. So, so one of the things that I have done in my course is, I think for the graduate students, ELNEC to me is like the baseline of achieving the palliative care competencies. And then I designed activities that would go beyond that to give them practice in advanced care planning, and serious illness communication. So one thing I should probably tell you is that the course I teach is taught online, and it's primarily asynchronous. So it's not like we can use actors to practice, conversations. We don't all get together. These nurses have all different schedules. And so I try to create assignments that students can work on at their own pace within the module. And I'm just going to show you, I have like one thing that I do, and I'm going to share this. This is an advanced care planning and advanced directive assignment. So I have students, once they complete the ELNEC modules, I have students then look at various forms of advanced directives. Advanced directives, there are many different kinds, and people can choose their own type of advanced directive. And so I have them explore the different options, like the National Hospice and Palliative Care Organization has a directory of advanced directives for your state. So that's a good one to go to. Prepare for Your Care, developed by Dr. Sidore is another one. Respecting Choices is another one. And so I have students look at various advanced care directives. I also have them play the Go Wish game. This is a kind of a non-threatening way to begin a conversation about what is important to a person. And then I have them prepare an advanced directive. I have them tell me who they identified as their healthcare surrogate and why, and share what their preferences are from the Go Wish game. So that's one assignment. And so then the other assignment I was just going to show you briefly, and then I want to hear about what you guys are doing, is this, and let me know if you can't see this, but this is my discussion forum. So in the online class, one of the ways that I engage with my students is in a discussion forum, and I'm known for having pretty detailed discussion forums. Like I tell them, it's like writing a little mini paper every couple of weeks, and the modules are 2 to 3 weeks in length, so they certainly have enough time to do this. So I prepare a discussion forum activity. I have them go to the Palliative Care Network of Wisconsin website and review one of their fast facts. I also have them go to the GeriPal website. Since this is a geriatric focused class, it's appropriate. If you were inserting it in a pediatric class, you would just make it appropriate to that patient population. And then I have them examine some of the controversies about advanced care planning versus serious illness conversation, look at some of the research on that. And then I have a little case scenario where they've been a nurse practitioner for a patient who has COPD, and how they would initiate a conversation about serious illness communication. And I provide them with a lot of resources to enter in. So I think the main point, I'm going to stop sharing that now. I think the main point is, that I'd like to convey is the ELNEC modules are wonderful. They're well done. I've been using them for well over 5 years, and I've never had a student give negative feedback about, the modules. The content is great, and they're a baseline. So usually you want to add some kind of, assignment in addition to the ELNEC modules to give students to understand advanced care planning, or advanced care billing as a nurse practitioner, or things like that. So great. So yeah, what we thought today, since we have a little bit fewer people here, we typically break up into groups, but since not everyone is using the graduate program, we thought we would stay in one big group and let some people who are using the program share their experience. So Susan, you raised your hand, so if you'd like to share your experience, go
Oh,
ahead. And
Can I just ask a question?
Sure.
I just have a question to ask you. So I actually had developed, used ELNEC, and we have a for the undergraduate as an elective is ELNEC, which is fantastic. So I'm teaching it this summer, and of course, with all our conversations with curriculum, some of the graduate faculty, they're like, well, maybe we'll take your course this summer and get an idea. And so I guess I'm asking, as you're being more of an expert in the graduate program, and I'm sorry, my phone keeps going, is if they take my undergraduate course, no pressure or anything there, how much of it, like I understand I could probably flex because I am familiar with the graduate curriculum part. Do you think that's a good idea, or do you think I should just like self-study them through the graduate program modules? Do you see what I mean?
Yeah, so I think I do, but let me know if I didn't get it. So, I think like when I requested to review the graduate, one of the programs, it automatically sent me the graduate program since I have a nurse practitioner degree. So like if your faculty requests the free copy of the program, they may automatically get the nurse practitioner program. I mean, the modules are very similar from the undergraduate to the graduate. And if they're looking for themselves as nurse practitioners, I think they should look at the graduate program. If they're looking at it from the perspective of teaching undergraduates, then it would be fine for them to look at the undergraduate program.
Well, they would be integrating it into their curriculum as, on the FMP, excuse me, spectrum.
Yeah.
But this is so new to them, and they're just like, well, maybe we'll just take your course this summer. And I'm like, mine's undergraduate. So that's my thing is like, do I recommend it just so they can get a taste of how some of this can be used and, kind of help them along that way? Because I do a lot of the ones in the undergrad online, some of the exercises and stuff like that. So I just wanted to get your input as far as, is that a good idea or kind of a waste of their time and I should do something different?
Can I jump in there? Can you hear me?
Mhm.
Susan, I actually think it's a great idea. The thing I would add is that people, and I share this with particularly around the undergrad faculty that are unfamiliar, is you can also use the G-CARES and the CARES as sort of a self-assessment tool for faculty.
Okay.
Like I really am not sure, I can't really speak to this. And so it gives them a sense of kind of where they're at. But personally, I think that's a great idea to have them attend the class just to get some foundation.
Some foundation. Perfect. Thank you. No pressure for me or anything, but.
And really what you're doing is you're their cheerleader then to encourage them to put it into, their program. And if you, as being the expert at your school, then you can serve as a resource to them if they have questions about like, well, how do we use this? Or like for me, in having students complete the graduate modules, I just have them simply complete the modules and give me their certificates, and then give me a brief feedback on, because I really want their feedback. And so it's like submit your response to one question. How do you think you will use this in your advanced practice? And so the assignment that they incorporate into their class could be pretty simple, but then maybe you would be the resource person if they wanted to add something about advanced care planning or role playing a serious illness.
Yes. That's really good. This conversation's all started because this year, I kind of put myself out there and was their specialty like visitor and faculty lecturing and just used a module. And I'm like, see, you can do this to, like, not just so you can do that, but they're like, oh, we don't do end of life stuff. Can you just come as our special guest? And I just used a module. And so then now they're a little bit interested more, which is great. But I didn't realize that's what that was doing, was sparking interest by just being a visitor into their classroom and using the module. So nobody's done that yet. I'd recommend it because it was really, it's caught some energy.
I have one other little thought to add to that I think is very common. What you're talking about, Susan, is that some of us are kind of what the folks might at our institution see as the person that knows more about this particular content area. And yet we can't necessarily provide all that direct teaching, if you will, and faculty that may not be familiar can go through the modules, as Toni was saying, and you were saying it's free. So they can go through them, sort of self-educate. And then if, that's a great foundation for everyone to start. But then we really need to provide some of the things, as Toni's amazing examples, to help them unpack that in the classroom. And maybe that's where the expert comes in to help them do that, so that you really engage the faculty and put some ownership on that for them, because this is primary palliative care. This is not specialty.
Thanks for that input. Thank you.
Christine, you have your hand up?
Yes, thank you. I just wanted to respond to the comment about the faculty saying we don't do end of life content. And as Andra said, this is primary palliative care. And I think as faculty who are more comfortable with this content, we certainly can lead the way. But I think part of how we can help reframe ELNEC is in talking about how this is something that every nurse needs to know, including every nursing faculty, and that palliative care is a sphere unto itself in the new essentials. And so when people say, well, we don't do end of life stuff, how can we message that this isn't just about end of life care and this is about nursing ultimately? So we all need to be able to do this.
Yeah, great points, Christine. I mean, I don't know about everyone's schools, but we're in the midst of moving toward competency-based education. So we've had all faculty, on deck participating in rewriting our program outcomes and beginning to work on our syllabi to change them to competency-based. We've even revised our mission and vision statement. So I think, for faculty that say we don't do this, I think the AACN Essentials, the new essentials, give us great support in saying it's a sphere of care. Everyone needs to do it. It's care that's appropriate across the lifespan, and all nurses need to have some skills in it. And we just need to decide where we're going to place it in the curriculum. So you can certainly, use the AACN Essentials as your defense. And we had Jerry Altmiller on consulting with us at our university. She's an expert on competency-based education. And, she came into one of the calls and she said, our school is not strong in palliative care, but we're going to begin by inserting ELNEC. And I was like, yeah, yay for a competency-based education expert to realize, yeah, this is how we start. Then that's wonderful. Andra, did you have something to add there?
No, I think that's all great. I want to circle back for a second, because it looks like in the chat several people are in the process of getting up close and personal with the essentials. And there is a document there's a publication where we have crosswalked the CARES and G-CARES, the revised ones, with the essentials competencies and subcompetencies, and that may be a useful document as you do your own sort of self-study in your curriculum. It may help you. And that one is also available on the Faculty Corner website.
Yeah,
I would like to show you the Faculty Corner, but I'm afraid to. I'm afraid I'm going to explode my internet situation. But just so you guys know, if you go to AACN nursing.org and then you go to ELNEC, there is a faculty corner where it's a pretty dynamic page that's changing all the time. And we're trying to put up, you know, recent publications for folks, very focused in from the perspective of faculty. There it is. Thank you. So there's a link there in the middle, new publications and resources. We're popping new articles that come across our desks in here for you. At the top, there are teaching resources and evaluation tools as well. So this is available for faculty. We are trying to encourage folks to not reinvent the wheel and share our exemplary teaching strategies with each other. Right here, some of what is included there are simulation examples. And at the very bottom, if you have, at the very bottom of the page, if you have a call for submissions, if you have something that you would be willing to share with others, we of course give you credit and would post it here. So the goal really is to support each other in this process. And you also can find past webinars here. So one of them in, I think, September of last year under the pre-recorded section, there's one that really gets into the meat of the essentials and the GCARES and that whole crosswalk thing if you're interested, or you can just go find the article and read that. So any questions around that, happy to help you with that, but this is a great resource for folks. Is there anybody else that would like to share kind of what you're doing or questions or concerns that you have?
I know Gina shared a couple things in the chat. Gina, would you like to share, unmute and share a little bit?
Sure. Hi, I'm Gina Credden. I'm assistant professor at the Nebraska Methodist College, and we had just started incorporating the graduate curriculum into our doctoral program. And as you were talking, Toni, I couldn't be more familiar with the DNP Essentials. We meet with the doctoral team every month. We have discussed how this could be incorporated and actually piloted it this fall in my adult gero course. As an adult gero CNS, I lead that, and I'm the geriatric coordinator for the college. And then we also started adding it. So we do also have an adult gero CNS track and an adult gero NP track in primary care. What we decided was that we weren't going to have the synchronous session separately, and all practicums join once a month and discuss their caseloads and talk about the modules. So how we kind of started it is, instead of just allowing the graduate students to just do the modules and then get their certificates, because we had some feedback last year that that wasn't actually translating to practice, that they were just going through the motions and using it as a checklist to get that stuff done. What we started doing is incorporating it in our practicums with our clinical adjunct faculty, and they have started using reflections, discussions in a live setting. So that synchronous session does help with that. As you mentioned, having an online format, sometimes that is really difficult to manage some of the having an actual patient or simulation. So what we decided to do for nursing 816 is our intensive over the summer when they do come together on campus, which is only 3 times per program. We're going to go ahead and do some simulation with it this summer and see how that goes. It is something that, as the undergraduate team has not been using it, we've kind of talked about how are they going to incorporate it. It does really, come down to the money and the cost factor. Also, with financial aid to the students, is it written into the contracts that this is going to be part of the curriculum every year? So, obviously that return on investment, and the finance department has been very interested in that because, of course, we receive federal funding. How does that work? So just a lot of logistics to work, but the feedback has been good so far. So we're just continuing to plug in the modules where we can. We do have a couple of times where we watch some of the exemplars that you have, and then there's some that I also work for the VA system, so that we also use crucial care conversations, and we have rolled out a lot of modules through our APRN training, which is all actually online for free to the public. So we utilize that as well in some of our case scenarios and have them play roles with each other and do a lot of role play. So that's been very helpful. But again, it's a work in progress, and we're still working on all of those things. And hopefully by next year, we'll have it kind of a little bit more down pat. And as you mentioned, for the faculty that are unfamiliar, that may not be palliative care specialists or have certifications in palliative care, it's very uncomfortable at first, because it's like, how am I going to teach a concept if I don't know it myself? And so we've been working with faculty to get them more familiarized with the concepts. So I appreciate it. I think it was Susan, I'm not sure who, just spoke about incorporating it into their coursework this summer. I think that's a great idea for faculty that haven't had it before, to get them that introductory feet wet, so to speak, so that they can kind of learn what they don't know. So
yeah, wonderful. I love that idea of involving like your adjunct and your clinical faculty in using the ELNEC like as a reflective tool and debriefing and how it actually happened, you know, what actually happened in your patient loads and across tracks, so all the tracks getting together. I love that. I think what Andra would say is, you know, I do know that there is a way to coordinate with Relias to get the ELNEC program added to your bookstore, so that it can be, students can use their financial aid to actually purchase then the ELNEC program. So you may want to, if you have a contact at your bookstore, you know, check out with them to put them on adding the ELNEC undergraduate and graduate to your bookstore listings. One thing that I did is, you know, I got an internal grant. It was a Women in Philanthropy grant, and I basically went and, you know, made the case for why all nurses should be educated in primary palliative care, and they gave me $10,000. And what that did was, there was no overhead, there was no, you know, protected time for me. I used that entire $10,000 to buy ELNEC tokens, and then I used the free tokens to insert it into the curriculum and kind of build buy-in, and then, you know, establish other I don't usually teach in, to make sure that you know, that it gets incorporated, and that worked pretty well. Although sustainability is always an issue. Like, I've noticed that sustainability of the ELNEC undergraduate program has wavered a little bit in the traditional BSN track and in our ASD program. So I have to work on that, but we're addressing it with our work on the competencies. So yeah, great idea. So Andra, did you want to add something? Sorry.
No, it's good. I wanted to follow up a little bit on the pricing and kind of give you guys a little bit of an update. We have, when I say we, Dr. Megan Leapy, who is kind of my partner on this grant, we have drafted a letter to the Relias folks to talk about some of the barriers in the current. Actually, it'll be great if you want to keep sharing. I want to show you the pricing. There's a section on that page. It's a barrier that it's a one-year subscription, and faculty, schools that really want to do this across different courses are limited with that time frame. So we have kind of listed, itemized several barriers. And if you go up to the materials, there you go. So this is the current pricing situation. So if you have 150 students and some schools, I think this is true for UP where I am, it's built into course fees. So there are a variety of different ways to price this, but we have a meeting with Relias in a couple of weeks to really reevaluate their some barriers that they have sort of self-created to make it more accessible to faculty and different schools. And so the other thing I wanted to mention is that if you're at a school where there are limited internal folks that identify maybe as having some palliative care comfort in that realm of care, that partnering with your clinical folks is also a nice way to collaborate and bring them into your classroom. There were some ELNEC summit happened last week in, of all places, Hawaii. And we had faculty attend. We had a session 4 faculty that were there to learn the various different curriculums. They'd signed up for the different courses, advanced practice or the core and all of that. But there were some nurse practitioners that came and said, you know, we really want to reach out to our local school and support them. So you know, that's just another way for you to think about delivering the material in a course, have them do the online module, then bring in your expert from the, you know, practice setting and have them help the students debrief and unpack the content. So that's another idea.
So I know that some other folks have posted in the chat. Christina, Kimberly, and Judy just posted. Does anyone want to add anything, unmute and add anything to their comments? Go ahead, Gina, go ahead.
Oh, I was just going to add to what Andrea had just mentioned. I think depending on your curriculum and how your course alignment is, you know, depending on if you're doing BSN to DNP tracks or if you're going from MSN to DNP or whatever those avenues are, I think that barrier that you mentioned was very through our evaluations from students was one of the things, because we have 3-year, 4-year, and 5-year plans for our DNP students in different various tracks. So if we're only offering the 12-month option with the course access, that has become an issue because we have practicums throughout the year and even into the next calendar year. So what happens is they'll go ahead and, you know, get that started, and then 12 months in, they're already losing access and having to repay. And sometimes that's not always on the, like you mentioned, through the bookstore, through the fees. It's not possible because they've already paid for that semester or what have you. So that has been definitely something that we've talked about as well. And so I'm glad that they're working on that.
Christine?
Thank you. So I work at University of Portland with Andra. So we have the ELNEC modules in both our undergraduate and graduate curricula. One of the things that was really important to us was we have 2 tracks in our DNP program, Adult Gero and FNP, and we wanted to make sure all of our students had this content since it's primary palliative care. So the ELNEC graduate curriculum is built into our chronic disease management course, which all of our students take in both tracks. We're hoping to kind of build that out a little bit. It'll be taught again in the fall, and I have some meetings planned with the faculty teaching that class to talk about how we can reinforce some of the content. And then in the Adult Gero class, the Adult Gero track, we have a specialty palliative care course, and we develop those skills a little bit more with the simulation that we've put together with a standardized patient so that they can actually put these skills into practice. And I'm hoping that we can do that with the FNP students as well, because these are just critical skills.
Any other comments or questions?
I wanted to respond to Judy about the issue of self-care, and you know, this content is you know, not like pharmacology. And one of the things that we did a webinar in November that is recorded here, and it's really looking at how we foster student well-being in and through providing this kind of education. We give them the tools to feel more comfortable out there in practice, but yet we need to be sort of exquisite in how we convey and, you know, share that material. And so, you know, acknowledging up front that, you know, we have a content warning, for example, to talk about how this could trigger some emotional responses. So I appreciate the comment from Judy. I just wanted to add that.
Yeah, and I also have, you know, a content warning in my assignments, like if this is, you know, making you upset or dealing with unresolved grief, you know, feel free to make an appointment and discuss it with me. Another thing that I do in regards to self-care in this class for the nurse practitioners is in the earlier module, I have them write a prescription for themselves for a self-care activity, and actually, you know, like write out a prescription to themselves of what it is they're going to do for the next month, and then in the subsequent discussion, you know, bring it back and ask them if they are comfortable sharing, you know, how it went, and then bring that into a conversation about the use of non-adherence and non-compliance in patients, and how that can be used as a judgment lens. So I think even in a, you know, asynchronous environment, you can do things that encourage self-care. You can do things that encourage students to check in with you if they're having issues with the assignment or need extra support from our counseling center is wonderful. So if a student needs extra support, I can definitely refer them to that as well. And if it's okay, I thought I'd take a minute. I have one feedback from a student this semester that completed the ELNEC graduate program. It's just two brief paragraphs. I was gonna read it, and then we can do final comments. Is that okay, Andra?
Yeah, that sounds great. Toni, I think maybe Judy might want to share a little bit, kind of follow up to that conversation, and then we'll hop over to the student voice, which is fabulous.
Sure, go ahead, Judy.
Right. I appreciate it. I'm really loving to hear all this conversation. I've had the pleasure to work as nurse navigator and spiritual care for our palliative care team at Children's Hospital in New Orleans. So I'm very, very passionate about palliative care. And I also serve on a board for Louisiana, Mississippi editorial board, and contribute there, and just recently went into the National Hospice and Palliative Care, so for their work group. But I see how valuable it is whenever you teach this information. For some of us who do it daily, it becomes a little bit easier. It's never easy. It's always very humbling, but I think it's really important for us to be mindful whether you're bringing in other faculty who are telling you we don't do end of life care. All of us are going to do end of life, whether it's with a patient or a family member or ourselves, it's going to happen. And so these are wonderful tools to prepare us really well. And whether we are actually participating in that care, or perhaps we're supporting that student or that nurse or that family member, and just providing that extra layer of support, I think can be invaluable. So
Thank you. Thank you so much for that.
really.
So I'll just read this brief 2-paragraph thing. This is a feedback from a student that I had in my course this semester who completed the ELNEC program. And so she says, after completing the 6 ELNEC modules, I feel much more knowledgeable regarding the use and implementation of palliative care for patients. I found this content extremely valuable to me now as an RN in the ICU, where initiating these conversations for families are difficult and are often avoided unless approached by the palliative care team. My colleague and I did a presentation for another class regarding the initiation of a palliative care consult for all patients admitted to the ICU, because we frequently see not all patients are shown their options regarding their disease states. It is a topic we are both very passionate about and want to change in our practice as APRNs. I found the second module, Communication in Palliative Care, the most influential in caring for patients approaching the end of life. Therapeutic communication is extremely vital in any relationship, but when talking about a person's end of life, it is of the utmost importance that family members and patients can trust their healthcare professionals when approaching these conversations. I found lots of useful communication tactics and tools to take back to my practice as an RN and in the future as an APRN. Since I plan to see myself as an ICU APRN, I see myself using this content throughout many shifts in my career. I feel more confident and have more knowledge regarding end-of-life palliative and hospice care for patients after completing these focus modules.
Wow, no better testimony than that.
Sums it up.
So the idea in summary, hopefully, is that you explore the modules yourself. And it sounds like folks are kind of well on your way to integrating this. Come back to our webinar series. We may pause for the summer and then start up again. I think next month is pain. We're going to flip back to the undergraduate and take a look at the pain module. And then we'll start the fall with graduate pain probably. If you are new to these webinars, now that you have signed up, you're going to hear about all the rest of them. We're going to keep your email, keep sending things to you. So be on the lookout for that. And you will also get the slide deck from today that includes several different supplementary sort of videos that you might consider using, the last 3 slides, I think. And then there's a QR code to get onto the faculty corner. So that's pretty much all we've got. And we are 1 minute ahead of things in spite of all the Wi-Fi issues. I'll see if I can really quickly come back on and say, thank you so much.
Thank you.
Thank you, Toni.